Good afternoon, everyone. Thank you so much for joining us today for the August Children's Caucus webinar. Today, we're going to be talking about concentrated care and investment to improve behavioral health care for Appalachian children in Ohio. When we think about who these children are, they are the children in 32 of Ohio's Appalachian counties, which stretch from Lake Erie down to our state's eastern border and to the west suburbs of Cincinnati on the Ohio River. This is an area that absolutely needs concentrated care and investment, especially for children. One 2019 study from the Ohio Alliance for Innovation in Population Health made the point that if these Appalachian counties were combined into a single state, it would be the second most economically depressed state in the country. So from concentrated poverty to trauma and behavioral health challenges, the opioid epidemic, lack of broadband access, and more, the children in Appalachia are facing a host of challenges to their well-being. And that's why this month, the Appalachian Children's Coalition will join members of our caucus to discuss recommendations for addressing the challenges to and the disparities in child well-being that persist in Ohio's Appalachian region. We're going to be talking about recommendations for how to use ARPA funds, also known as American Rescue Plan Act funds that have been dedicated to the region. And we'll talk about how Ohio can sustainably use these dollars to better support children's behavioral health. And that's through a number of ways, some of which you wouldn't expect as necessarily directly relating to behavioral health and other needs. We're going to talk about workforce development, school-based healthcare services, crisis stabilization, supportive services, and more. And so with that, I'm very pleased to welcome our speakers today. And I'd like to introduce you to Randy Leidy to lead us into the rest of the discussion. Randy, thank you for being here.
Thank you so much, Representative. I am really excited to be here today. I do need to start, hopefully not too much of an apology, but I'm in an airport lounge doing this presentation. So if there's some background noise, I apologize. I'll stay muted as much as I can. I also just want to open by thanking all the members of the legislature for your participation in the caucus. I think your interest in and commitment to children in the state is commendable, and having sat in on many of these caucus sessions as an audience member, I'm just so excited about the work that you're all trying to do. With me today, we have a couple of other individuals who I think will be able to provide a much clearer case than I could of the Appalachian region and the challenges that children face in it. Stephanie Starcher, Superintendent for Frye Local School Director of the Gallia Meigs Adam Board will be able to share some information that just paints a bit of a picture for the region. Just very quickly, as far as the Appalachian Children Coalition goes, you can see our mission is to improve the health and well-being of our region's children. What we want to do is promote access to the care and support the children need, wherever they may be, in their homes, in their schools, in their communities. Important to our work is the care for children, and that system is really built on the notion that there are services that are important to deliver to children, as reflected in the columns that you see there: school-based health, crisis services, family supports, residential treatment. But then really key to all of those are three foundational needs that you see along the bottom of the building there. In our region in particular, there's a need for still ongoing expansion in terms of broadband access, not just access to broadband, but access to the endpoint technology that's needed to use broadband. Workforce development, critical issue in our region and across the state. We documented as many as 800 open behavioral health workforce positions in our region, and my guess is there are many others that we missed in gathering that data. And then also data to inform decision making. Uh, the illustration on the right, just very quickly, to give you a sense of the coalition, shows you the type of work that we do: advocacy, convening. We try to build communication hubs in the region, facilitate resources, workforce development work. And really, our role is to be a servant to those who serve children. So we stand ready to be a resource to partners in the region, to the legislature, to anybody who needs help in terms of trying to meet the needs of kids. With that said, I'm going to turn it over then to Robin Harris, the Executive Director of the Gallia Jackson Meigs ADAMH Board. She'll share some data and some information on the region, just to start to paint the picture of challenge, need, and opportunity. Director Harris. Director, you're muted.
How many years have we been doing Zoom, and I'm still needing to be reminded to unmute? Thank you so much, Randy, for leading in, and Allison for your invitation for us to present today. As Randy said, I'm Executive Director of the ADAMH Board for Gallia, Jackson, and Meigs counties. We are at the heart of Appalachia and deal daily with many of the challenges that we're acknowledging today. According to the Ohio Revised Code, an ADAMH board is responsible for planning, funding, and monitoring a continuum of care for behavioral health services from cradle to grave, so across the population that we serve, but specifically, many of our challenges relate to serving children. If Allison, if you would advance the slide to the data. Randy and his staff have done a really nice job of bringing together some of the data that we work with. And while I'm quick to point out that on a daily basis, the data doesn't define us, so to speak, but it does set the foundation as we begin to plan for a continuum of care for kids. And as we work with partners in our community, many of these data points demonstrate clearly how we many times have to start several steps behind maybe some of the more affluent areas of the state. I would particularly point out that 42% of our population is rural, compared to only 20% nationally. The rural nature, the isolated geography that some of our families live in, make it very difficult for our provider agencies to provide home-based services or some of the more popular evidence-based programs that are out there. When people are generating services on a fee-for-service basis, there is a great deal of lost time just in travel. And then when families do not have access to adequate transportation, to public transportation, to come into clinics and be seen, we end up having to plan most of our services to be offered in a school-based setting, which then becomes very, very important for us to be able to work in a collaborative fashion. Many times we're braiding funds with the schools and trying to join forces in how we plan to serve the kids in the school district. I would also point out the behavioral health provider to resident ratio, greater than any state and national average. When you look at one behavioral health clinician actually having to spread themselves across 2,249 residents, that's overwhelming. When it's compared to the 700 to 1 for Ohio or 390 to 1 for the United States. This is something that bears upon us every single day as we're looking at how to effectively bring services down into a community and get the reach that we need to. Workforce is a primary concern. And I know that that's become a national issue. It's definitely a statewide issue, but it permeates everything that we do every day, trying to help reach families in a way that overcomes some of the factors that we're dealing with. Pointing out that Ohio has 6 children's hospitals, none of which are located in Appalachia. I particularly would want to point out that our children many times have to travel 2 hours or more if they're in need of psychiatric hospitalization. And one of the points that's brought out here is that we have 1 crisis stabilization facility in Appalachia for children. I'm proud to say that that facility actually is here in Gallia County. We don't have time to address all of that in this presentation, but I would point out that bringing that facility to fruition was an example of good old-fashioned Appalachian determination, because no one system would have been able to bring this facility up. We couldn't afford it in many ways, not just financially, but also geographically. There were many things to overcome to bring that up. But we believe it's an important step when investing in the local community in a way that locally determined factors are making the decision and driving the policy. And the fact that children should be served close to home. When we need acute care for a child, especially in behavioral health, having the child travel 2 hours away from home to get that care is just not good care. And so we have spent a great deal of effort into trying to bring locally driven and locally provided crisis services for kids in the community. Pointing out, Allison, if you want to advance the slide, I would just point out that there are many factors that create an underlying angst in families and in children. We have children entering the school district who already have so many adverse conditions, is that we're having to learn to come alongside our partners in the schools and work on mitigating trauma from preschool up. And much of that trauma is created by the underlying angst created by poverty. And so those are the factors that we work with on an everyday basis as we're trying to provide behavioral health services in a way that supports our school districts, our children's services, our juvenile courts. We all come together to plan that way, because none of us have the ability to do it all on our own. But I can't, and Randy will smile when I say this, but I can't stop my part of this presentation without saying, let's not stay stuck there. We try every day to be aware of the factors that play into what our children are bringing to us. But we also try to do our planning in a way that acknowledges the strengths of Appalachia. And so some of the asks today, as Randy moves forward and we look at the ways that we're proposing to address workforce shortages, our need for crisis services, all of those things we are confident we can do, and we can do them very, very well and with a great deal of accountability because of our determination to serve and because of our relationships that we're able to build in small communities. And so with that, I'll turn it back over to Randy for the next phase of this.
Thank you, Robin. I appreciate that. And I also want to acknowledge much of the data that we shared, not all of it, but much of it really was facilitated by the Children's Defense Fund Ohio and the work that they've done with Kids Count and other data activities. I'd like to ask Stephanie Starcher now, Superintendent of Fort Frye Local Schools, to offer some perspective.
Oh, good afternoon from Southeast Ohio. I want to thank you all for allowing me to be on the panel and for you taking the time to invest and listen to the challenges facing kids in our region. I've been an educator in Appalachia, Ohio for the past 26 years. I have seen as an educator how the mental health crisis in our community is ever growing, as at an all-time high. When the state passed wellness funds several years ago and districts received funds earmarked for wellness, Fort Frye as a district contracted with a local behavioral health provider in order to staff what would traditionally be called social workers and counselors on site, and parents could then give permission for the kids to be seen on campus, because oftentimes after school or during school, the kids weren't getting to the appointments for a variety of reasons, transportation being one of them. So we were thankful to have the money to be able to provide those resources for our schools. However, as Robin and Randy have mentioned here, we couldn't find the workers. So we would have the money, they would advertise, the local agencies would hire workers, and then there would be turnover. And I kept hearing from the agencies that we've worked with that it's very hard to recruit workers to this area. The pay isn't quite as competitive. There's not incentives for the training and the college certifications and degrees that are required. And so the workforce development is a huge issue in the Appalachian region as far as mental and behavioral health care, because even though we have the funds through our wellness funds to support the clinical settings at the school, getting the workers here is a huge challenge. So I just want to attest to that. I know that we had a waiting list of kids to see practitioners at school, and some never got to be seen because there just weren't the providers whatsoever. I think I want to just, and I can share some of my experience with this as a superintendent, but I really want to talk about my experience as a mom. My husband and I are middle class socioeconomic status, and we live in Appalachia, and we have 2 daughters, and one of our daughters is 16 years old, and she has severe mental health issues. This is a very emotional situation for us, because in the last 3.5 years, our daughter has tried to commit suicide multiple times. And I want to tell you that no parent should have to go through the challenges that we have had due to limited access to services. Our daughter has been in the crisis stabilization unit somewhere across the state of Ohio over 20 times. My husband and I actually just had her at Nationwide 2 weeks ago. When she's there, we have to miss work to be up there to see her. We have to have the gasoline to travel, which if you're middle class like us, we can afford that. But I know that there have been so many Fort Frye families that when we suggested taking them to Nationwide or Cincinnati Children's, that wasn't possible. The other issue becomes when we take our daughter, like so many people in Appalachia, to the local emergency room, they are not equipped to deal with suicidal patients that are juveniles, particularly, or children in crisis. And so my husband and I have had to make the tough decision of, do we take her to the local ER, or do we try to transport her to Cincinnati Children's, where her doctors are based, on our own? And I can recall the night that we made the decision, we didn't want to wait 3 days in the local ER to get an ambulance transport, because we have waited 3 days in the local ER to get a transport to the crisis stabilization unit at Cincinnati Children's or at Nationwide. And we didn't want to do that. We didn't think it was healthy for anyone in our family. We had another child to take care of. And so one night in the middle of the night, we make the drive 3 hours and 10 minutes to Cincinnati Children's to take our daughter there. And I sat in the back with her and I held on to her, and my husband had the kitty locks on so we could just make sure she wouldn't jump out the car doors and harm herself. And we took that risk because we wanted to get care that night. We didn't want to go to the local ER where she would sit in a room where there were no psychological services. No one would see her and support her. And those are the kinds of things that we were willing to do. And I keep thinking to myself constantly, if I, as an educator and a highly trained professional, and my husband, who works in the insurance business and have access and good insurance, are having to do this to get our child the kind of services that they need because they're not in Appalachia, then what about the families who don't have the education to jump through the hoops that I have? They don't have the financial means to do that. They don't have the resources. And so, you know, it's a tragic situation, because what's happening is parents aren't pursuing these resources because it's such a struggle to get to them. And then these kids are staying in our communities and their mental health and behavioral health challenges are unmet. And it's just causing more and more challenges for the school systems, the communities themselves. And so, you know, we've made it a passion of ours that not only are we trying to help our daughter, but also we know what our daughter has been through, and we do not want any other family to have to do that. You know, I know last week, in the last 2 weeks, I've missed 2 days of school, my husband's missed 2 days of work in order to be in Columbus, where our daughter happened to be this time. And a lot of families just can't afford to do that. I guess I also would like to say, to another example is specialized care. Our daughter receives dialectical behavioral therapy, and there are no providers in our region that provide that. So our daughter gets that through telehealth in Cincinnati. Every Thursday, we arrange that. Tomorrow, my husband is taking off work to take her to Cincinnati, where she's getting outpatient assessment from a specialized psychologist. Again, you know, the access to basic mental health care should not be a privilege. I know this is a state crisis. I know kids in urban and suburban areas are having similar issues as the kids in Appalachia, but they can, within 30 minutes, get the type of services and have public transportation possibly to get them there. And that's just not the case in Southeast Ohio. And I read an article where Senator Huffman was interviewed by one of our major urban newspapers, and he talked about in his hometown how sadly and tragically his family member, I believe it was his brother, was killed because there was a pothole in the road, and that he knew government was an entity that could fix that, and that there's lots of things that government can't fix. And I just challenge all of us that mental health in Ohio, the mental health services, it's something we can fix. It is an entity. So I just challenge us to think about how we can go about doing that together. And thank you for your time.
Thank you, Stephanie. I think you provide a compelling illustration of what life's like on a day-to-day basis for children and families in the region. And often we forget, I think, about the very real world implications of a lot of the decisions and steps that we take. So I thank you for that. I'd like to transition now to talk a little bit about where there are opportunities for impact in the region. And, you know, over the last couple of years, we at the coalition have really been engaging in extensive due diligence to really flesh out where there might be some opportunities. Allison, if you could advance the slide. Yeah, and I do want to say that the information I'm going to share today really does reflect an extensive amount of effort to develop an accurate picture of where opportunity may exist. We've talked to more than 100 partners, affiliates, providers, and others across the region to get a sense of conditions on the ground, and a very localized sense. I mean, I think it's important to acknowledge that there really are not Appalachian solutions to anything. There are local solutions that run across the region, and we need to be responsive to local conditions. We've spent a lot of time exploring data from multiple public-private sources. We are now conducting behavioral health assessments in approximately 17 Appalachian counties, and eventually hope to do that across all 32 counties as a way to better understand conditions in every county. looking at best practice models, a whole variety of things that we've done to try to make sure that if we are suggesting something, we know that what we're suggesting is first of all doable. There are partners willing to do the work, projects and activities that are shovel ready. And then also projects and activities that are sustainable. They're not going to disappear if initial money goes away. So with that said, I'd like to suggest some key investment opportunities in the 4 areas across the region. The first of those is around workforce development. And we've spent a lot of time looking at workforce development. Our coalition is in the process of creating a behavioral health workforce hub for the region that we're very excited about. And really our focus is on 3 dimensions of workforce development. First, helping to be more planful about the workforce, identifying where there are needs, where there are opportunities, developing ideas around shared recruitment, retention services, things like that. We believe there's huge opportunity around developing the workforce, helping the workforce to really expand and grow, helping professionals and paraprofessionals expand their scope of practice, helping people to move into collaborative models. And then we also believe there are a lot of opportunities in terms of better supporting the workforce. The fact is, many people enter behavioral health work and they disappear because they get burnt out or they face considerable stress. A story that I've shared is prior to my role at the coalition, I was dean of the College of Health Sciences and Professions at Ohio University, and I remember talking to one of our graduates who was looking for social work positions. And she found a position in Cleveland. And I remember talking to her at graduation and asking, how she decided to go to Cleveland. And she said, well, I had 2 opportunities. I had one in Washington County and I had one in Cleveland. And I took the one in Cleveland because it paid me $10,000 more. And when she shared what she was going to make as a social worker, one thing we have to consider is the stress of social work, the challenge of social work, and the fact that there are social workers who are making the same amount that you could make potentially working at a Target store. I talked to somebody whose brother got a job at Target, was making more money than I know there are people in the behavioral health workforce making. And that's a challenge. We have to address ways to help the workforce feel appreciated, feel valued. We've been working with staff at OMAS around some conversations around helping to overcome the stigma in the workforce. So there's a set of things we can do, I think, around planning, developing, supporting the workforce. We are suggesting 4 specific activities that, again, are doable, shovel ready, and sustainable. One is building out this workforce hub. We eventually will have 45 to 50 affiliated organizations that'll be part of this hub that will come together and achieve greater strength through collaboration. We also believe there are an opportunity to create a training collaborative for community health workers, patient navigators, other paraprofessionals who can really contribute in great ways to the workforce. Often a challenge in those areas is for people to find and access the training that they need to move into those occupations. And so we believe there's an opportunity, again, through collaborative effort, to develop a training mechanism and an umbrella one-stop shop model where anybody can find the training that they need. Now, we also see great opportunity for funding for multiple institutions to come together on different curricular pathways. Having spent more years than I care to mention in higher education and 13 years as a dean, I was always struck by the degree to which we create educational pathways that create barriers and challenges to people. And so one thing we're doing is working with 12 higher education institutions across the region to explore opportunities for different curricular models built on stackable content, streamlined transfer, across institutions, competency-based models, things like that. And then finally, we think there's an opportunity to provide the financial support to people who want to pursue education and training, what we're calling a career impact bond fund, a fund that somebody could tap for education training costs that they may encounter. They could tap that fund at no interest, unlike a traditional student loan. And they would have the ability to repay those upfront loans after they're employed, and with a much more generous set of conditions in terms of repayment. One challenge with student loans is there are individuals coming out of college basically owing the equivalent of a home mortgage, and really looking at decades and decades to pay that off. Also, student loans are only accessible to those who are entering degree programs, and a lot of people are wanting to pursue training that doesn't involve degrees. So we think there's opportunities there to create a fund that could be managed and could be flexibly available to people wherever they may be. Just another quick anecdote. I was talking to somebody a few months ago who wanted to become a community health worker. And she made the comment to me that she couldn't afford to get trained as a community health worker, which I found surprising, because at Ohio University, they've developed a community health worker training program that's available at no cost. And I asked her, why she didn't pursue that. And she said, well, I couldn't afford the money for a babysitter for my kids to go to the training. Things like that. We should be able to help people address those kinds of challenges. So we have a whole set of workforce development suggestions. You can see also everything we do, we like to work with partners. And so in terms of workforce, we're working with 7 behavioral health provider organizations, more than 40 affiliated organizations, the higher education institutions, Building Bridges to Careers, which is an organization that facilitates internships and placements and things like that. So certainly one big area of opportunity. The second area is in child and school health. And this is an area of huge opportunity. I think, as Robin mentioned, so much of our healthcare services are delivered through school settings, just because in many communities, the school is the only resource that's there. And so we are working with a set of partners. You can see Nationwide Children's Hospital Partners for Kids, Akron Children's Hospital, Integrated Services for Behavioral Health, Connect Ohio, and the Ohio State Legal Services Association, on a concept that would create a child and school health systemic model across the Appalachian region. An effort that would create up to 15 school-based health clinics that would deliver primary care, behavioral health, oral care. Those clinics would be linked to other schools through telehealth capacity, creating a hub and spoke model. There are opportunities to integrate behavioral health and primary care, not just in those clinics, but in other practices. I mentioned expansion of oral health services. This model would also include home-based case management services. We would want to bring people where the need is. Sometimes it's not feasible to say that people will leave home to access care. Sometimes we need to bring the management of that care to them. And then a set of activities really targeted to parents and guardians in terms of enhancing health literacy, financial literacy, legal literacy. So people have more information to make the decisions they need to make. And then a set of out-of-school programs, after-school programs, boys and girls clubs, programs through museums and activities like that. We have been able to document the incredible impact on child well-being of having services deeply embedded in systems that are meaningful in our communities. And certainly, as I mentioned, the school is a big one of those. A third area of investment that I wanted to mention is, and this goes back to what you heard from Superintendent Starcher, is investment in crisis stabilization services. And Robin did mention that a crisis stabilization center just opened in Gallia County. She could tell you that was a multi-year process to get that done. We know that center is just meeting a drop in the bucket of the total need across the region. A center with 16 beds is a great resource, but it only has 16 beds. And so we actually are working with 4 additional ADAMH boards on a concept for another crisis stabilization facility that would be in Eastern Ohio, really serving children across 13 Eastern Ohio counties with wraparound services. And there is an opportunity to recruit a developer to build a facility. We've talked to a number of organizations about providing services in that facility. We know there are partners that can get the work done if we can move this idea forward. So, yeah, certainly another crisis stabilization unit would be huge for the region. And again, without it, every day there are numerous cases. In fact, right now, as we're on this call, there are numerous cases of parents struggling with what Stephanie Starcher described. You know, they are sitting in Toledo or Cincinnati or further away, trying to get help for their kids, taking time away from work from their other kids to do that. And this type of a unit is just critical for the region. We also think you could pair that with other services for children in crisis. One struggle we have in our region is a lack of therapeutic foster care placements for children. There are counties without a single placement site, and as a result, children who need therapeutic foster care, children often in the most extreme level of crisis, who need the most stability in their lives, are being sent hours and hours away for therapeutic foster care. I recently talked to somebody from one of our counties a case manager who was describing a child that had been placed, I believe it was in Denver, Colorado, because they could not find a foster care placement closer than that. So another critical need. We also think there are opportunities to expand CASA programming in the region. Approximately half of Appalachian counties have CASA programs. These are court-appointed special advocate and guardian ad litem programs for children who are court-involved kids, another important resource as well, and a set of things that we believe could be offered for CASA program support. And then the final area that I wanted to touch on is support for assessment and evaluation and data support. I mentioned in my opening that one critical deficit that exists is a lack of data to utilize to make decisions about best investments. And it's not so much that the data is lacking, but that it's not accessible and it's not available to those making decisions. So we are looking with a number of our partners at the idea of a center in the Appalachian Child, which would basically gather and distribute data on Appalachian child health issues, gathering data from public sources, the Ohio Department of Health, the Ohio Department of Mental Health Addiction Services, Department of Education, but also data from private sources, building that out as a freely accessible, freely searchable database that anybody could access to paint a better picture of children and their challenges. I mentioned that we're in the middle of a process of conducting 32 child behavioral health needs assessments. We eventually will do those in all 32 counties, but the reality is you can do an assessment, but conditions evolve. So we've talked about a model that would involve a cycle of updating of assessments to make sure the picture we have is really current at any given time. And then also, we believe there's an opportunity to provide more support to organizations on program evaluation and assessment. Again, too often decisions are made for investments. There's no evaluation of those decisions. There's no understanding of the impact of those. And we believe we can offer or build a model that can offer support to organizations that may not have that capacity. And again, you see partners involved with this. Ohio University has been a great partner around data. Our area ADAMH boards are working with us on some of these ideas and the assessments, and certainly entities such as Nationwide Children's Partners for Kids as well. And so what you have is a set of recommendations. We believe that these things are all doable in the short term, and they all have opportunities for sustainability built into them. And I would say I could sit here and run off about $300 million worth of ideas I have for investment in the region. That's not what we're doing here. We're suggesting an investment of potentially 20 to 30 million of one-time funds can get these sorts of things off of the ground. There are certainly other things that could be done more long-term, but these are a great starting point to really begin to build out response to the conditions that Robin and Stephanie suggested. We can also provide more information on any of these as well. If you'd like to know more about any of this, you can reach me with the Appalachian Children Coalition. You can see my email there. We'd be happy to come out and sit down and talk with any of you or anybody else who's just interested in knowing more about what can be done to make a difference. So thank you very much. We'll stop there, and I guess we'll open it up for questions now, I believe.
Yeah, thank you all again so much for this presentation. Before we get to the Q&A questions, are there any legislators who have questions for the panel?
Hi, Hannah. I wanted to ask a question if it's okay. For Randy, so this is State Rep Monique Smith up here in Western Cuyahoga County in Northeast Ohio. And one of the things I wanted to just kind of bring up is my own long-term frustration about, feeling like I live in a state that has really almost systematically ignored or defunded social service needs and certain school programs. And I am a big advocate for behavioral health. And we see that now that's a fast growing need. So I guess one of my questions to you is, am I right in that assessment? Do we invest less than other states as a whole in many of the programs that you see a need for, especially for impoverished children? And what's new as far as, I feel that for years, there have been many experts, such as the people on this panel, who have been begging and asking for support. So can you talk to me about some things that are new about not just the source of the funding for ARPA, but what we're asking for or what we're proposing today?
Yeah, thank you for those questions. Yes, I think traditionally Ohio has had a history of underfunding social services. There are a couple of good resources. The Children's Defense Fund has pulled together some information on that, and then also the Health Policy Institute of Ohio with their health dashboard information put out. They pretty consistently have painted the picture of Ohio's investment being well below the national average, and health outcomes in Ohio being below the national average. So I do think that's a challenge. I believe that there is growing awareness of that. So when you ask me what's different, I think one thing that's different is that there are perhaps eyes being opened about this a bit more than has been in the case in the past. Now that's just a start. That doesn't solve anything in and of itself, other than you start to have more dialogue. I think too, a second thing that's different is right now we have entities and individuals in state government who truly are committed to and care about kids. I mean, certainly, this caucus is a good example of that. I think right now, Governor DeWine, whatever you believe about him broadly, has expressed a strong commitment to the children in the Appalachian region, and we haven't always had that as well. I think the other thing is, and this is really what excites me about the work we're trying to do, is the opportunity to think in a much more complex way about potential solutions. So let me use as an example workforce development and the need for more behavioral health workers. Often when something's done, what it's been is a one strategy solution. Let's provide student loan forgiveness. There was done that. Well, that doesn't begin to address the complexity of the problem, right? If it's a complex problem. There's not a simple solution. And so one thing that we're really driving and having a lot of conversations across the region about are very complex, multidimensional solutions. So to use workforce as an example, then there's the model with the career impact bond funds of addressing educational costs that isn't just loan forgiveness. That could cross more individuals. Built into that model is attention to how to come up with new educational pathways, revising curriculum, so that we don't continue to say, if you want to be a social worker, it's an 8-year commitment of your life to get there, to go through step by step everything you need to do. We can provide shared services on recruitment and retention to individuals. The hub that's being developed will provide shared recruitment services. So instead of every agency recruiting against each other, we can really try to recruit collaboratively and get people placed. There's opportunities for innovative paid internships, a whole set of things. And I think if something's different, it's the degree to which we can drive that complexity of thinking around solutions. I think there are some other things going on. So for example, just again, anecdotally, there is now an effort to build a multi-state compact that would allow counseling credentials to cross multiple states. So now, you don't have to be separately licensed in every state. You could have a license, and then you could potentially work across states. I think that opens huge opportunities for us to recruit people to the workforce in a very different way. It's a very long-winded way of saying, I think we can drive to complexity and we can drive to sophistication, maybe in a way that hasn't been the case in the past.
That's really helpful. Thank you so much. I appreciate it.
Are there any other questions from lawmakers before we get to the chat? Okay.
So if I may, I'm Mary Lightbody. I represent the northeast corner of Franklin County. I'm a 30-year educator. I have a brother who's a psychiatrist who used to do adolescent psychiatry. So I know how challenging, it can be to meet the needs of our young people and our adolescents, especially when services are not readily available. Mr. Leidy, I really appreciate your suggestion that this is a complex issue, and so there's no one simple solution. But let me just go on record that I'd be very happy to work with you on some legislative pieces to support some of the work that you're doing and others are doing to provide better services. For example, I have a bill right now that hasn't gone anywhere yet, but which is it's called a Grow Your Own Teacher bill. So if you come from a school district with 50% or higher free and reduced lunch program and are willing to become a teacher, and we could modify that to become a teacher or a social worker or a school psychologist, for example, we will apply to our program. We will pay for you to go to college. Only thing we ask is that you go back to your home district and work for 5 years to give back in your community. So we could do that and modify it to be a grow your own social worker, a grow your own. And as you point out, doesn't necessarily need to be somebody who is certified in college. So maybe there could be a 2-year associates program that we could develop at OU or some of the regional colleges that are around, or the community colleges that are around, to provide people who have enough training to be able to be helpful and useful immediately, but also could then later lead to additional licensure and accreditation as they gain experience and continue their education. So let me know if I can work with you in any way. I'm currently represent District 19 and be happy to help.
Thank you for that. I mean, I think that idea is spot on in a couple of different ways. I think I struggled when I was a dean at OU because every year we'd bring all these students to Athens, and many of them came from other places, right? Cleveland, Columbus, Cincinnati, wherever. And they'd spend 4 years there, or my son's age, 5 years there. And then they would just disappear and they'd leave. And I always felt like we didn't do enough to help them get engaged in a way they might stay. But if they would come and leave, in my mind, the solution is that grow your own model, right? I think it's a lot easier to engage somebody and get them to engage if they've grown up in a community. So I really do like that idea. I can definitely follow up with you without a doubt. I'd love to know more about that proposal.
And obviously the individuals who are in that program would need consistent support and mentorship throughout the college experience, because sometimes the college experience or even an accreditation program can be daunting if you're, from an area where, there's not a very high population, where the opportunities are more limited. Even just going and participating in those programs can be challenging to the individual. So they need support throughout that and mentoring once they go back as well.
I'm glad you mentioned that too, because one thing I neglected to mention about the workforce development hub that's being built is it will include very tailored mentoring, coaching, and advising services for any individual that wants to pursue behavioral health work. And I do think that's critical. I saw this firsthand when I was in higher education, that it's much like Stephanie Starcher mentioned about parents struggling to find the care for their children. We bring people to higher ed who really need help navigating and negotiating and finding their way. So I do think that's a critical element as well.
Senator Coonsey, did you have a question for the panel?
No, I did not, but I just wanted to say thank you, Randy, so much, and to the presenters today for this great presentation. So I'll let anybody in the chat that wants to answer or ask and answer questions, but thank you for being here and providing this information.
Thank you for having us.
All right, so the first question in the chat is, there's a few of them in one. The first question is, what kind of funding can be used for this work, and what funding has been used? Does this ultimately need to be a legislative push to allocate state funds in the long term, or would it be some kind of grant funding along with federal funds? And finally, how can the state make sure these resources are cemented in student life?
Yes, all of that. I think that the reality is, again, because of the complexity, I think there's a need to really think about multiple sources of funding support. Now, right now, as all you in the legislature know, we're at a time where there's been considerable investment in states with ARPA funding, and we've already worked with the legislature, and thanks to the legislature, we've been able to facilitate some ARPA funding to support some things like residential treatment facilities in the region and things like that. I think there's an opportunity there. Again, if we can advance shovel-ready, sustainable projects, you don't want to put one-time ARPA monies into something, build it out, and then it's gone, right? When the money's gone. So I think that is one route. I think there are also some other opportunities for federal support. We've been engaged in conversations with the Appalachian Regional Commission and Department of Health and Human Services about some opportunities. One thing I would like our coalition to do is to be a resource to facilitate grant development for the region. That we can find grant opportunities and work with partners to develop proposals and bring the resources for those. So I think if we're going to address this, it's got to be a combination. It's got to require some support from the state. I think there's private support that comes into play. And then I think the sustainability models, many of those are achieved through billable services. In some cases, they can be achieved through private philanthropy. In some cases, they can be achieved by how we structure things. So, the Career Impact Bond Fund that I mentioned as an example, setting that up as a revolving loan fund with generous terms. But the fact is, it cycles and it repopulates itself versus let's put money in, give a bunch of loan forgiveness, and then we're done, right? So again, a long-winded way of saying I think there's a whole complex set of things that we can do that really reflect partnership from the legislature, but also from other partners as well.
And Robin or Stephanie, do you have anything to add to that one?
No, I think he covered it. I mean, no.
Yeah, I think the only thing I would add is that, and maybe it reflects back to a previous question, the movement I've seen after 30 years in doing system of care work in this particular administration and in recent years with the legislature is a movement to trust local communities more and allow more flexibility in funding. I know that funding must originate within a silo, but it's really helpful to the local community when it arrives not so clearly labeled in a silo. One thing that Stephanie mentioned was the student wellness and success funds. I think I saw districts in my 3 counties, I saw a couple of districts remain very siloed in their use of that funding and hire more school staff to deal with issues. And then 2 years later, the superintendents were knocking on my door saying, I think you guys were better equipped to do this. And so we kind of switched that up. But when the partnership was there, that the school districts trusted the behavioral health system enough to say, hey, we have this money, we know, this is the need. How can we do this together and how can we help? And then people come in with the appropriate expertise to deal with the increasingly complex issues that school districts are seeing on a daily basis. So I'm always an advocate for flexibility with accountability.
Great. Thank you guys so much for that answer. And I'll go ahead and pass it back to Representative Smith to close out today's session.
Thank you, Hannah. Thank you to all of the presenters and to all of the attendees today. Special thanks to our legislators who are on the call, who are taking time out of a busy schedule to continue to grow your knowledge about this important topic. State Rep Lightbody and State Senator Kunze, really appreciate your being here. If there are others on the call, I'm sorry if I can't see you. I'm looking into my phone, but wanted to really thank you, Randy Leidy, Executive Director for the Appalachian Children's Coalition, for leading this discussion and sharing your clearly deep expertise and for really bringing thoughtful initiatives to our state to really move the needle on Appalachian child poverty. And I want to thank Stephanie Starcher, the superintendent at Fort Frye Local Schools, and Robin Harris, executive director of the ADAMH board in Gallia, Jackson, and Meigs counties. I hope that we'll all take the information that we learned today about opportunities for advocacy, for convening and collaborating, and for bringing more resources to the families who need them the most in Ohio. We do have a special opportunity with ARPA funds to make sure that resources do become available. And now it's time for all of us to make sure that those resources get to the people who need them. So thank you for your time today, everyone. And look forward to seeing you at the State House next time you're there. Thanks a lot. This is Monique Smith, House District 16. Have a great day, everybody. Bye.